Okay, I think we have everyone on board now. And I hope nobody else is waiting to enter. We have let everyone in and we will get started. Good morning again. I'm Audrey Morris, Regional Advisor on Food and Nutrition, and I'd like to welcome you all to our webinar this morning on the progress in the region of strategies for the reduction of salt consumption. We have quite a few exciting speakers lined up for you this morning. And as you know, we are in Salt Awareness Week. So this is our webinar for Salt Awareness Week 2022. And in this webinar, we're going to share more about all the work that we're doing to support countries in the promotion and implementation of salt reduction strategies, and to also show studies conducted in our region that support this policy process. On our lineup this morning, as I said, we have quite a few speakers. We have with us Edward Nielsen from the Ministry of Health, Brazil. We have Ravi Rampasad and Shiva Diokising, who will present on some work that was recently done in Trinidad and Tobago, and Michelle Ash from the Ministry of Health, Trinidad and Tobago. From PAHO, we have Fabio da Silva Gomes, our Regional Advisor on Nutrition and Physical Activity, and we will also have some input from two of our consultants, Lorena Alemandi and Maria Bustamante. So welcome to you all once again. And just to go over with you, please put your questions in the Q&A when you have them. And also I'd like to remind you that we have interpretation. The button is at the bottom right of your screen. You can choose from English, Spanish, or Portuguese. So right now we're going to move into our webinar, and I'll introduce our, as I said, the Regional Advisor on Nutrition and Physical Activity, Fabio da Silva Gomes, who will give the opening remarks.
Thank you very much, Audrey. Ahora voy a mover al español.
Thank you very much, Audrey. I'm going to speak in Spanish. I would like to start by thanking everyone for being with us here today, for taking part in this webinar, in the framework of the week on salt awareness. This is from March 14 to 20, the week in which we are looking into effective means in which we can improve our health by kicking or shaking the habit of salt consumption, as we do every year. The Pan American Health Organization would like to join this worldwide campaign to work together internationally as a means of supporting countries to implement policies to reduce salt consumption in our societies, among our populations today. We're going to share with you some PAHO tools in support of the strategy to reduce salt consumption in the region of the Americas, such as the interactive PAHO tool for progress we made in countries to implement different interventions known as the SHAKE package. Also, our social marketing course and other means to reduce high sodium product consumption, ultra-processed and processed foods with high salt content, and some other activities that we've carried out with different countries for the implementation and to reach these reduction goals. Now, let's jump right into our presentation on PAHO goals to reduce sodium. As I said, this is the focus of our discussion today.
Entonces, la idea en esta presentación un poco concentrar en compartirles el,
Now,
el
what we want
trabajo
to do is share with you the work that the Pan American Health Organization has been doing in support of countries to reduce salt consumption in our region and to reach the world goal of WHO to reduce in relative terms the average consumption of salt by 30% by 2025. Specifically, we're going to talk about the new regional goals that have been updated to reduce the content of salt in processed and ultra-processed products. This was launched in October of last year. Now, reducing salt consumption by reducing salt in products will help us achieve these gradual progressive goals. That's just one of the best investments that can be made to reduce non-communicable diseases. These goals are so important for us to make one more step along that path. Thank you. Next slide.
Gracias. Como bien saben, la mayor parte de los países desarrollados
in most of the developed countries and developing countries, increasing number of countries, salt consumed by the population comes from processed and ultra-processed food from 70 to 80%, and from food served in restaurants. So what that means is to reduce salt consumption, we have to promote first the reduction of salt content in these products to ensure that they have less salt in them. And that is one of the first measures that we are considering calling for. I would also underscore that the sale of these products, processed and ultra-processed food products in the countries of our region, we see trends from 2009 to 2014, and in a number of countries, you see that this represents a large population, and you can see how sales rose by 8.2, 8.3% to 441 calories in 2014, and you can see projections or the fact that it rose by 2019 to 481. So this is a trend in which we are working within this context, in which there's a growing sale of processed and ultra-processed food with a high salt content in the region. And in addition to slowing down or halting this rise of such products with high salt content is one of our goals. Now, we recently just published these results. This was a study conducted with 9 countries, and the purpose of the study was to estimate the effect of the consumption of processed and ultra-processed foods that have excess levels of sugar, total fat, saturated fat, trans fat, and salt or sodium. And this as a part of a study about the quality of food and taking into mind the ingestion of these food items that do have a bearing on non-communicable diseases in the region. So as regards excessive consumption of these products that have these critical elements in them at too high levels, well, this affects countries' ability to meet their goals, according to those recommendations issued by PAHO. We're talking about hundreds of thousands of people, and these are 24-hour-a-day messages sent out, and we're talking about Argentina, Barbados, Brazil, Canada, Chile, Colombia, US, Mexico, Uruguay. Now, in keeping with the goals to reduce overweight and NCDs with the information now available to us. When these foods are consumed, that is, these foods are far from meeting the guidelines set by PAHO and WHO. And so here you can see what the likelihood of the population consuming foods with an excess level of salt is. If you look at the summary, the average of all of these products, you see that there's a doubling of the likelihood of this population not meeting the WHO recommendations if they do consume products with an excessive level of sodium, according to the guidelines. Now, on chart 2 rather, on the left, you can see the relationship between the consumption of products that have an excessive level of these critical items relative to recommendations for every gram of a product that's processed or ultra processed with an excessive level of sugar or salt. Total trans fat, saturated fat overall, that gram of increase is going to mean that people's food consumption gets further and further away of that which is defined and recommended by WHO. And so this is meaningful also for the consumption of salt, which is the topic we are here to talk about today. This just by showing that oftentimes we think that if we're consuming a food that has excess salt levels a little bit, that's not going to have such an impact on overall health. But what we see here with data from a number of countries of the region, that is that each gram with an excessive level of salt is going to mean that those people consuming this additional level of salt will be that much further away from meeting the goal as set by WHO in their guidelines. Now, what are our options for intervening within the host of different interventions within the SHAKE technical guideline to prevent NCDs? We need to measure and monitor salt consumption, the productive sector, and other activities to promote the reduction of salt content in food items and the adoption of labeling standards and the sale or marketing of these products, that these norms that are being established make it easier for people to clearly see on the label what contents are. This needs to be done for the population. So something else is to raise awareness and to empower people to get them to reduce their salt intake and to adopt other measures that can promote healthy food so that it doesn't really come down to the individual choices of individuals. We know that if that's what we do, we'll have limited results, and we really need to facilitate, make it easier for people to change their salt intake. Now, as far as regional goals that we presented, it's key. This promotes that we promote a political set of policies and political outlook to reduce this consumption and to thereby improve the health of millions of people who are negatively affected by excess salt consumption. These measures complement the efforts of national initiatives and seeks to serve as a regional reference for adhering to sodium content in products throughout the region.
Entonces, acá vemos en esa diapositiva.
So here on this slide, you see the different characteristics we promote. The number of categories went from 18 those from the 2015 goals now down to 16. We have 75 subcategories within those 16 updated categories, and there is a greater degree of specificity in the definition of these goals. The number of these categories used in 2015, that's what was based, the decision to make more detailed groups was based on. For 2015, the goals set for the region, if there was only a one category for all of the breads then, and now we have goals that have an influence on 4 subcategories of bread products. For example, you've got different types of bread, such as loaf bread, rolls, you've got wraps, naan bread, roti bread, as well as wheat-based or tortillas, breads with other added products or as aggregates, and other bread products.
Ahora, pasando directamente a las nuevas metas en esta
Now jumping
diapositiva.
right into the new goals on this slide, I want to show you the technical document that was recently published that goes along with this. If we could advance one more slide, or go back rather, one more slide.
Entonces, solo un poco comentar antes de cómo se presentan.
But before doing that, I just want to talk about how the goals are presented in the document. On the one hand, we again have the names of all of these categories, as you can see on the left-hand side. But in the column that provides a description for each one of the categories, we have not only the definition of the goal for 2020, but also 2022 through 2025. And these goals are established by milligrams of sodium, just as we had done in 2015. Now, we also decided to add 2 more columns on the right-hand side, which express the goals in milligrams of sodium per kilocalorie. That, in order to indicate that sometimes a product can reach the goal of the proportional reduction relative to what we had before, but can still be a product with excessive levels of salt. That's why it's important for these 2 additional columns to be here, because they show us that even when a product may have reached that salt reduction goal, it might still be too high in salt despite that reduction. So these columns make it easier for countries to identify, well, we achieved a reduction, but that does not mean that we can stop encouraging further reduction. There are other policies that could be adopted, that should be adopted to continue reducing salt consumption, even though we met this particular goal, because they are still too high in salt and can still have an overall effect on people's overall salt consumption. Now, as I was saying, this just to give you the links, the hyperlinks, and to show you what the publication looks like. This is a tool for countries to assist countries in the implementation of these policies, and these are available in both languages. The first goal of updating these goals was because, as a part of our having this goal of developing targets, updating each one of the different stages, so that we can continue reducing salt intake. And then, based on the data that we've gathered regarding salt content throughout the region, we observe that a large proportion of products for which we had already established goals, that those goals had already been met. And that means that now it's time to update those goals and move forward, because many countries have crafted initiatives and have set goals that already went beyond the goals that we had set for ourselves earlier. And so this is to encourage countries to make further progress in the reduction of salt intake and farther-reaching policies have been suggested. Here we have, again, in these publications, we underscore what those products are that have the critical or do not have the critical nutrients. And this was a response to the fact that we see a need to continue moving forward, updating those goals, and to stay abreast of all the different policies that different countries are adopting in the region of the Americas, AJO countries. At the beginning of last year, WHO issued its world guidelines for salt content. And I say this just for you to be clear on the fact that these points of reference are based on work done at the country and regional levels, which is what we did. But we also used data about products found in each country. The currently updated goals for the region and the points of reference established by WHO are aligned with each other. So the region is advancing, again, almost in lockstep or in full alignment with that which is being done at the WHO. On this screen, you can see other publications that will serve as a tool and input for countries in the furtherance of these goals. We have publications here that provide further information that serve as input. By way of these publications help complement all the information that we already had for our meetings and other encounters, and we can certainly help you with any additional information you need.
Finally, I would like to point out that we recommend these world target of reduction in the population by 30%. We also recommend to promote these targets in a compulsory and not voluntary fashion, and the compulsory new formulation of the sodium content in these products should lead to a systematic reduction in the consumption of salt, and this is why we should go ahead with compulsory policies and not voluntary ones. And we should also have a more sustainable law from the political point of view, as with compared to having other models. We have several examples in the region. These targets are feasible, as you will see, and also, as I have already mentioned, they coincide with the main reference points that were established by the WHO last year. So countries have a tool which can be used to continue intensifying the reduction of sodium in their product and also to identify those which, in addition to reducing the content, need to continue being regulated because of the excessive presence of sodium in situations where a reduction was obtained. And finally, I would, next slide, please. Finally, I would like to conclude saying that the reduction of salt consumption at the level of the population is one of the most cost-effective measures to reduce the charge of death and morbidity for non-communicable diseases. And we would like this to be one additional tool, which, in addition to other complementary tools, such as the front labeling and restrictions in marketing of unhealthy products, will guarantee the right to health of our population in the Americas. Thank you so much for this opportunity. We are here if you have any additional comments. Thank you.
Thank you very much, Fabio, for your very interesting presentation, very informative. Before we move along, I'd like to remind our audience that you can, or participants, that you can put your questions in the Q&A, and we will have a Q&A session after all the presentations. Our next presentation is on sodium contents in processed and ultra-processed foods in Trinidad and Tobago. And our presenters are Ravi Rampersad and Shiva Deokising, who conducted that study. Over to you.
Thanks, Audrey. Good morning, everyone. Sorry, Lorena, are you going to share your slide, or do you want us to?
Rosala will share. I think she's doing it.
Okay, perfect. Thank you. Right.
I'll just mention in the meantime that after the presentation, we're going to hear from Michelle Ash, the Chief Nutritionist from the Ministry of Health in Trinidad and Tobago, on how the ministry is planning to use this data to strengthen their efforts in the implementation of the sodium reduction initiatives in that country. Over to you again.
Right. No problem. Thanks, Audrey. Again, pleasant good morning to everyone. A quick note, I am presenting.
We're not hearing you, Ravi.
Oh. Right. Good morning, everyone. Good. Yeah. Right. So yeah, pleasant good morning. Greetings from Trinidad. Quick housekeeping. I want to apologize up front in case I have two little ones. I'm presenting from home. They're doing online school, so if they burst into the room, apologies up front. Shiva and I are very happy to be here with you this morning. We worked with PAHO last year with our company, Harvey Food and Beverage, to conduct a study looking at the sodium content in processed and ultra-processed foods in supermarkets across Trinidad and Tobago. Next slide, please. So we're just going to quickly run through the goals of this study and the overall parameters of this study. So our mandate was to really get an accurate picture of what's happening on the grocery shelves and what the Trinidadian and Tobagonian consumer is looking at in terms of processed and ultra-processed foods, and also by extension, the sodium content in these foods. We all know that NCDs is a perennial problem across the region. In Trinidad and Tobago, it accounts for, I believe it's over 80% of all deaths are related to NCDs. So the concern for sodium and salt in our foods is a real one. Our approach to try and get an accurate snapshot in time, our study covered about 3 to 4 months of data capture. We looked at 9 supermarkets covering Trinidad and Tobago, looking at both small and large supermarkets, independent and chain branches as well. We attempted to get a good geographic spread to really get a good snapshot of processed and ultra processed foods. So here you have the 9 supermarkets, and it gives you a sense of the geographic spread as well. The food categories is we use were the PAHO WHO 2021 categories. It's 16 categories, but we also included beverages. So that's number 17 at the bottom of the list. And our data capture uncovered 1,240 food products, unique individual food products. Next slide, please. Right, so this gives you a sense in terms of the approach. What we found was that as we went through the first, let's say the first 3 supermarkets, we quickly realized that we were getting a good snapshot of what is available. And thereafter, the range of new products we were finding started to reduce significantly. So by the time we hit the, let's say the 6th supermarket, we were able to already capture the majority of our products, and the last 2 to 3 supermarkets was really a validation exercise to find any outlier products or validate that the products we indeed captured were unique and there were no duplications in our data set. We'll talk a little bit more later on that challenge, because we did find some issues with same brands, but having different barcodes for the same product in different supermarkets. So that could be that products were sourced from different countries as well, different distributors as well. Next slide, please. So our study, PAHO partnered with the University of Toronto, and our study used the Flip app developed by the University of Toronto. I want to hand over to my colleague Shiva, who will talk a little bit more on the Flip app.
So our field staff utilized iOS devices. The application is built for iOS, and the journey starts with scanning a barcode on a product, which then creates a unique record within the platform. It then allows the users to capture the NFT imagery, so images of the NFT, the front of the package, the back of the package, left and right. For this study, we captured the NFT, the front, the back, in some instances, the top and the bottom as well, where there was information around the ingredients and so on. After this data was captured in the field, it's uploaded from the device, all of the images along with the record information that is captured in the field. And then manual data entry was done within the web portal to transfer the NFT data from the label that was captured in the field to the platform, which is, there's a sample on screen. To ensure some of the accuracy around this, we had a bit of a buddy system that was in place with the data entry and reviewing of the imagery and so on, to make sure that what was captured in field was entered accurately. I believe we actually had a twice check for the manual data entry that was done of the NFT labels. Within the system, the unique identifier remained the barcodes or the UPC for the products that was scanned. So there were instances that the system was able to help us detect that the field staff, someone had already captured it previously, and that allowed us to keep moving forward quickly throughout the range of products that were available in Trinidad, but then also detect where we may have some shortcomings and so on. Get forward to the next slide. So within the findings, just initially, so I'll give a high level. The highest mean sodium content of the findings landed in the sauces, dips, gravy, and condiments category. With those, most of those 98% of the 161 items captured within the category exceeding the PAHO 1-to-1 sodium to calorie guidance. The soups category and the processed fish and seafood category both ranked up there as well. Next slide.
Sorry, Shiva, if I could just jump in on that.
You go back a
Sorry,
slide.
can we go back to the previous slide? Yeah, so just on a personal note as well. So we had a team of researchers with us for the data capture, and Shiva and I also did some of the validation of the data capture. And so we were in supermarkets ourselves as well. So we're coming from a slightly different background, research, consulting, food and beverage as well. Not necessarily food science background. So this was an interesting exercise for us. And I remember talking to Audrey and Tara about this from PAHO, about this experience. And it forced us to look at food labels. So we actually were going into friends and families' homes and, and asking to see what they had in their pantry. And just to give you an example of how this, in terms of how this can translate in terms of the information being shared globally, translate into action in really supporting your own health and well-being. I randomly was home by my parents. My mom had this habit of buying these cups of soups, and she would have it with a slice of toast, for instance, as a light meal in the evening, for instance. And I remember just picking up the package and looking at it. And it's only because of this study that I was intuitively aware of the sodium levels and what is the recommended daily allowance. And this thing, I believe, was 5 to 6 times above the recommended allowance for the serving size. So something that was meant to be a healthy snack or treat, a light thing would in turn be something potentially detrimental to health and well-being. And this is something, across the board as well. When it comes to things like the processed peas and tin beans as well, something I personally have tried over the years to try and get more into my diet, not realizing that the tin beans I was consuming was actually contributing to my own hypertension, which is unfortunately my reality now as well. But I've been able to rectify that and realize if I try to cook these things and add my own salt as needed rather than looking at processed foods. I think this is just a sort of a personal input on how this study and looking at sodium levels has impacted me personally as well. Right, sorry, Shiva, you can go ahead.
Yeah, next slide. So some of the categories that had the lowest mean sodium content, granola and energy bars, nut bars, nut butters was actually included in this category as well. And the beverages, which included soft drinks, no alcoholic beverages and so on in that category. Beverages included the soft drinks and juices, and then fresh or dried plain pastas and noodles. So these are those that sodium may be added to after while you're cooking and that sort of thing. That ranked with 100% of those items falling within the PAHO sodium to calorie guidance.
Sorry, if I could interject as well. Under noodles did not include things like ramen packs with the seasoning packs accompanying. That would have fallen under soups.
Oops. Yes. Next slide. To take a little bit of a deeper dive into the broad findings, out of all of the products that were surveyed, more than half of these are over 25% over limit of the PAHO 1-to-1 sodium to calorie guidance. So that is, you know, almost the key everyday food categories in Trinidad and Tobago. So the breads, the cheese, the processed fish, you know, or salt fish and that sort of thing, and the sauces we love. The majority of these categories, they all fall outside the recommended sodium limits. And this is technically categories that represent the everyday reach for food in Trinidad. And that was a very strong eye opener. You know, when you just look at the level of categories or the percentages of these categories that fall even 100% over the limit, there are a lot of portions within there that do so. So categories remain that have the highest concentration per 100 gram or 100 ml. Those were really the soups and the sauces. Ravi mentioned the personal story around this side of the soup. You know, I think I would probably have to mention something around the size of the sauces, but that one I'll let Rav go a little bit deeper into any bits that he wants to on this slide, and then into some of the additional content.
Yeah, I mean, I think it to reinforce what Shiva is saying, the sort of modern or move to more modern lifestyles and fast-paced living, fast-paced eating really points towards overconsumption of processed and ultra-processed foods, because it's convenient, it's quick, it's fast, and it's easier. And I think over the years, the push to make things either low calorie or low sugar or low fat has led to manufacturers trying to figure out how can I make my product palatable. One of the ways is to add more salt to make it, you know, so it's a texture thing, it's a palate thing, it's a taste thing, and you know, that becomes quite difficult to untrain. Anyone who has had to transition, learning that they're hypertensive and has tried to transition a diet would realize that everything, as Shiva said, that the everyday items they eat, from the breads, the cheeses, the soups, the sauces, Caribbean people in general eat a lot of salted fish, for instance. So that is a huge thing to try and change behavioral habits. But you know, so I think one of the most important things is having the accurate information to inform policy and to inform the general population. Yeah. Next slide. So obviously we have a lot more data and more in-depth data, so that well, Audrey and Tara, I don't want to put you on the spot, but I guess that data would be available to members of the audience as needed. The questions we wanted to sort of quickly discuss as well is where do we go from here? And our colleague from Ministry of Health, Trinidad and Tobago, will speak to the policy implications. But we want to talk a little bit about how do we go forward with this study and potentially replicating this study. So Shiva, I don't know if you want to jump in on the first point.
Yeah, so within the data capture, there were some issues in the field and that area. And I think within the report, the comparison and so on couldn't be as strong to prior studies completed because there was not insufficient data. And I believe one of the things that would be really good is if we could prepare a method to focus on how we can sustainably, continuously capture data that's required to enable the policy making further, to enable the comparison of countries that have already made headway and may have made changes within their policies, and to have that cycle to check. So one of the things that we see as possible is gamifying that continuous data capture and having the consumers themselves focus on what's on the label and share that data internationally or within the region via platforms similar to Flip and that sort of thing. But switching the focus on to letting the customer do some of that capture, pay some attention to what they're consuming, as well as we've seen our researchers and myself and Ravi encounter during this study.
Yeah, I think that's important. It supports engagement. It supports the consumer taking ownership over the process as well, and it supports that sort of continuous data capture. And as well, Shiva comes from a tech background as well, so working within apps and coming up with ways to innovatively engage with stakeholder groups, through this whole sort of gamifying an approach, I think is something that merits further discussion.
Yeah.
Yeah, so I believe that's, we'll be here for the Q&A as well. So if anybody's interested in the approach and some of the challenges and lessons learned, I think that is one of the critical areas, is lessons learned in terms of what we can do for further replicating this study, either in Trinidad and Tobago in years to come or across the region as well. Right. Thank you very much for your time.
Thank you for the time.
Thank you very much, Ravi and Shiva, for that presentation and for your very insightful comments on how the work that we do in research and in policy needs to inform what is being practiced by the layman, by non-scientific people. So thanks once again. And we'll now have our comments from the Ministry of Health in Trinidad and Tobago, Michelle Ash, on how the ministry is planning to use this data.
Hi, morning, everyone. My name is Michelle Ash. I am from Trinidad, the Ministry of Health, Trinidad and Tobago. Good morning to all our panelists, Dr. Morris, Dr. Malcolm, panelists, and also our participants. So I'll give a little perspective with regards to a little background with regards to this particular topic. I don't know if Rosella may have my presentation. It may assist me with, I have a bit of a low bandwidth on my end. I don't know if they have a presentation up.
Okay, it's not up as yet. Rosella, can you load that presentation? Okay.
Yeah, okay, great. Yes, thank you so much, Rosella. Okay, so this is my presentation for Sodium Awareness Week with our specific focus on Trinidad and Tobago. So I belong to the Nutrition and Metabolism Division at the Ministry of Health, and I will let you in on some of our interventions, policy work, as well as some information regarding our databases that we have regarding information as well on some food products as well. Okay, next slide, please. Okay, so just a bit of a background, our chronic disease risk factor, we had a chronic disease risk factor survey in 2012. That report came out, that was through PAHO. And what we found was, of course, our risk factors are extremely high in terms of risk for chronic diseases. Our population, 25.7% of us are in the obese category. Diabetes is at 20.5%, and hypertension as well is actually 26.3%. And we also have that coupled with the low fruits and vegetable consumption, and which is less than the 5 servings a day of combined fruits and vegetable intake. So we can see that with regards to salt and sodium, we do have a lot of work, because there is also a genetic predisposition in our population with salt-sensitive genes. So therefore, talking about salts is very appropriate to help address some of the chronic disease issues that we have in the country. Next slide, please. Okay, and our top causes of death remain chronic diseases, of course. Unfortunately, heart disease still ranks at number 1 at 25%, followed by diabetes and cancers, and cerebrovascular disease coming in at 4. Next slide, please. Okay, so going into some of our interventions, we have had a lot of movement with regards to, there was a Caribbean Moves, and that we then translated that into our own campaign, national campaign, TT Moves, and we would promote 3 main things in this campaign. We would talk about get moving, physical activity we emphasize simple things, water, drinking more water, and fruits and vegetables. And we decided on these particular things because of what came out of the PAHO risk factor survey, the STEP survey. And we felt that these were very easy messages for people to digest and consume, and they would have a big impact on you long term. And the TT Moves, then we translated it into various messages as well at various points in time for different observances. So one of them would have been eat less salt, and that would have been promoted during, for example, Salt Awareness Weeks. And we would, one of the messages we have here, for example, bottled seasoning is actually quite popular. And however, a few of them actually contain added sodium. And some of them, I've noticed they do not actually declare levels of sodium or other nutrients of concern on their labels, because I'm not sure, well, nutrition labeling is still not mandatory in our legislation. So that is actually one of the compounding issues that we will have regarding monitoring as well. All right, next slide, please. Okay, and our community outreach is quite extensive. We've had a lot of what we call community health fairs in collaboration with a lot of our NGO groups, our faith-based organizations. We get a lot of requests from schools. We've always worked very closely with schools through our Healthy Me caravans, we call it. We have like a specialized program where we have different components. We have Eat Healthy, the Active Me component. We have the Loving Me component, which focuses mostly on mental health, and the supporting social part of it as well. So we go into schools, for example, and one of the things we also do is gardening exercises as well. We show them how to plant little kitchen gardens, plant things we commonly use in our everyday cooking in the kitchen. We use a lot of seasonings here in Trinidad and Tobago. So we show them how to plant chive, what we call bandania. Some people might know it as cilantro, culantro. So we have quite an extensive reach. You will see kids exercising here in the programs. Another activity we actually do from time to time, at least once every 2 years or so, is the National School Quiz, and that will incorporate different aspects. One year was focused particularly on nutrition. I was in 2018, and that was hosted by our former Director of Health Education Division, Ms. Yvonne Lewis, and you will see her there at the bottom, presenting prizes. And, you know, there will be a whole host of different types of interventions. Once we do health fairs for the communities, we check blood pressures, blood sugars, basic screening, etc. And also kids get involved when they go to schools. They get the hands-on experience of getting to cook or learning how to prepare basic things for themselves. And of course, during the pandemic, we try to transition this as much as possible, and in collaboration with our NGOs such as Diabetes Association, they were able to help us still do some cooking interventions in some type of way. And they also hosted their own workshops. And I think one I left out, industry awareness. We also had quite a few industry awareness seminars throughout the years. And we would occasionally meet with food manufacturers from time to time to bring them aware of the various policies that we're working on and how those things, particularly with a focus on school health as well, so that we get healthier products in our schools. So we had some of those from time to time as well. Next slide, please. Some of the newer interventions that we have include the Healthy Youth TT initiative, which is a takeaway from the overall national campaign of the TT Moves. And it commenced in the beginning of 2021. What we had was we launched programs in various communities. We selected, I think it was about 4 or 5 communities where exercise equipment was installed in certain communities that had the required space. Of course, we will do the site visits and everything to make sure that it would have been feasible. So thus far, there are those few free gyms actually accessible to the public with regards to that particular program. And I think it is a bit underutilized. Maybe it's not as well advertised, I think, now, because there were some hiccups when we had the lockdowns after we installed the equipment in 2021. And then, you know, certain personnel had to be rehired, etc. So they had a few little hiccups during the pandemic when we installed it. But as I am aware, there are at least 2 to 3 communities that are actively up and running. So I think it will be on our end to advertise to the public that those are available. So communities like Bagatelle, etc. We have some in Miaro. Those are some of the more rural areas. Next slide, please. So policy strategies. So in the Ministry of Health, we have three main things I would like to focus on. Our National Strategic Plan for the prevention and control of NCDs that was actually launched in 2017. So the time period was up to about 2021, but we still do use some of the recommended strategies from that overall document, which will also impact on chronic diseases such as hypertension. The National Nutrition Standards for Foods Offered to Children in Schools is another document that has been extensively worked on throughout a number of years. And we have taken the last set of advice from our advisor, Dr. Morris, and we are revising it according to the PAHO nutrient profile. So there's still a bit of work to do with that document before we finalize it, because we have to revise a lot of the categories that we initially started out with. But we are going to closely actually align it with that PAHO nutrient profile, as at least for prepackaged foods. That was the last meeting that we had. And one of the other policies we have is child obesity prevention policy. So there would be some areas that would be also relevant with regards to salt consumption, prepackaged foods in terms of like marketing, etc. So there will be different impacts and different things being addressed in the various policies. Next slide, please. Okay, so this is just some of the updated educational materials that we had. We would have updated these, I think, 2021. So the majority of it should be very current information, and we try to make it as attractive as possible, especially for schools, for use in schools, etc. So we had ones particularly actually focusing on sodium. Next slide, please. Okay, and also the Ministry of Health, we have within the Nutrition and Metabolism Division, we also keep a database actually of snack foods. And this was actually for the purposes of our educational programs. So I would like to thank Ravi and Shiva for their extensive work. We actually can we can have a conversation. I would really like to get some more information from them and also share with them the further information that we have in our department. Our survey really was done in 2018 or so. It didn't cover as extensive. It was not as extensive in terms of products covered by Ravi and Shiva. They covered an entire gamut of food groups, and we really just stuck to things that kids eat in schools, things that are sold in schools, school cafeterias, etc. But it was really a supermarket survey as well. So we did cover like about 1,000, we have about 1,000 entries, 1,000 items that we looked at, and we had various categories like health bars, granola bars, biscuits, candies, cereals, chips and corn kernels, those kinds of things, nuts and legumes. And we have like a special category that is quite popular in Trinidad called preserves. Those are like fruit preserves, but we tend to, those are actually quite high in sodium, as when we looked at the data, that is what we saw. We went a little further in just taking the information from the nutrition facts panels, and we decided to also look at it in terms of the macronutrient profile model. And only 54 out of the 1,000 plus snacks that we looked at actually could be classified as so-called healthy in terms of the macronutrient profile model, unfortunately. So we have quite a lot of work to do in terms of what products are available on the market. From Ravi and Shiva's presentation, I saw that the categories that were more or less highest were sauces and condiments, gravies, etc. Now, this is a cultural thing for Trinidad and Tobago. I've been to a few Caribbean islands, and I've noticed, I think we are one of the islands with this particular quirk for, we call it wet food. We like a lot of sauces. We like a lot of gravies. Our food has to be very wet. And I think our social media was a buzz yesterday when a popular fast food restaurant decided to charge. They put on an extra charge on packets of ketchup and other condiments that we use, pepper sauce, etc. And the entire country was in an uproar. So this shows you how close and dear to us these condiments are. I think we will make a big impact if we actually maybe speak with food manufacturers, maybe have some intervention with regards to just that one category alone. I think we will make such a big impact with regards to condiments and gravies. We like a lot of stew gravies and curry gravies, pepper sauce, but everything has to taste good. So we put a lot of added salt to it. We use a lot of ketchup in our country. So I think this is a unique cultural thing that we can actually look at. We have data to back it up with regards to this study that was just presented to us by Ravi and Shiva, and we thank them very much. We would definitely be using the information with regards to the policies that were mentioned today, because those are still in the works for development. So one of the first policies that we probably will be utilizing it in is the for schools, so that we have mandatory guidelines for things that are served and sold in schools. All right, next slide, please. And that will bring me to the end of my presentation. So thank you very much. I am looking forward to sharing my information and exchanging of conversations with our researchers here today, and also incorporating the revised guidelines from PAHO that was released recently as well. Those are very expensive things that we could actually put into practice. So thank you very much for having me today and presenting on behalf of the Ministry of Health of Trinidad today.
Thank you so much, Ms. Ash. It was our delight to have you, and we have had so many interesting presentations this morning. We are running a bit behind time, and we hope we can make that up at the end. I will ask our presenters and panelists to please keep checking the Q&A for the questions that are being posted in that section of the screen. So now we're turning to Brazil, and we're going to have a presentation from Eduardo Nilsson in the Ministry of Health, Brazil, about the economic effects of sodium reduction policies in Brazil. And this is about a study that was conducted in that country. So we're hearing from a different perspective now, a different country. Over to you, please, Eduardo.
Oh, thank you very much, Audrey, and thank you for the invitation and for being here. Good afternoon to all. Good morning. Well, it's still morning. And next slide, please. I will speak with two hats, both at the ministerial level, but also as a researcher on salt policies. And I'd like to stress for the beginning that most of the studies are part of this RDRC project, which was coordinated by Dr. Adriana Blanco from Incienza, Costa Rica, and engaged many countries in the region and had a health and economic policy impact component, which was very important, that helped many of the countries, including Brazil, to continue. So it actually led to partnerships with Brazil and Costa Rica, now with Paraguay, Mexico, and other countries. And we're open to expanding that, sharing technologies and sharing methodologies. Next, please. So firstly, next slide, please. Oh, thank you. This is a quick overview of my presentation. I will speak about some data that are very much intertwined, and actually health and economics are very intertwined in terms of these policies. So first speaking a little bit about the baseline data, and then moving forward to the burden of disease and policy evaluation, considering both what was called ex-ante evaluation, which is a comparative risk assessment before the policy takes into place, but also what we are planning to doing in actually evaluating the policy itself in the future, in terms of the many outcomes and outputs that can come from policy, from reducing salt in foods and salt intake to the actual outcomes on cardiovascular disease and other diseases related to excessive sodium intake. Next, please. So in Brazil, we, as many countries in the region, we consume too much sodium, so almost twice as much as recommended by WHO. And the figure at the bottom shows how we've been monitoring the changes in the dietary sources of sodium, which is very important. So we're seeing that we still have a large participation of culinary ingredients, mostly table salt, but it's been reduced over time. Meanwhile, processed and ultra-processed foods are increasing a lot, so they're taking the place of the actual foods and meals. And that's very important for us to take in consideration when designing and implementing the policies. Next, please. So speaking about the burden of disease, next please, it's very important for us to set the size of the problem, the burden of the problem to policymakers, to the population. And so one first message is that even if countries don't have the tools to do that at the first moment, there are tools at the Global Burden of Disease that have information for all countries in the world. So we'll have data on deaths, on the prevalence of disease, incident cases, the disability adjusted life years. So this is just to show how the problem in Brazil. All Africa, of course, Brazil has a huge population of over 200 million people. So all numbers are very inflated, but shows that among all the dietary factors, risk factors, dietary sodium is the largest of them. So it's very important. It's a political priority that we should have. Next, please. So, but we will move forward to looking at the actual national data. First, looking at the costs of disease. These are very straightforward modeling studies that we use mostly survey data on population prevalences of disease and risk factors, and the costs, as long as they're identified by the ICD code, the International Code of Disease. And we found that among the non-communicable diseases, hypertension is the one that costs more to the health system. It costs over $500 million per year in terms of direct costs. That means hospitalizations, outpatient cares, and medication. And that doesn't even account for what is the cost of primary health care or the private sector. So it's very important. It is a huge economic burden as well. And that's important to show to policymakers, to decision makers, and also to industry when you're engaging with other sectors, and for civil society, so they can build strong advocacy for these policies. Next, please. And then we move forward to actually addressing salt. What if, or then we modeled, what if the population of Brazil consumed an average 5 grams per day? And the numbers are huge, the impact is huge, both in terms of epidemiological aspects, but also the economic aspects, because over 47,000 deaths a year are attributable to excessive sodium in Brazil. And that leads to costs, direct and indirect costs of disease that are over $1 billion per year, considering both the direct costs that I spoke about that are related to the health system of disease treatment, but also in terms of the economy, because an unhealthy population, it may die prematurely, and we may have the problems of presenteeism, which is working with less health than the perfect, and then we'll have less productivity, but also absenteeism, which is missing work because of disease. So and that isn't even considered here. We're only considering the toll of premature death. So we know that we are being very conservative, and the economic burden is even larger than this. Next, please. And there are different kinds of evaluations, and this is something I'd like to stress, because in different settings we will have different data availability, expertise in modeling, time for even in terms of the policy making. Time is a key element, so we may not have enough time to developing and analyzing data. So there are a set of methodologies that can be used in practically every setting. And so that's very important for countries that want to engage in these projects. There is an open space to adapt the methodologies and to generate local data, which is very important for tailor-made policies. Next, please. So firstly, that leads to, I think I should have put the slide before, but because of the different dietary sources of sodium that we have in Brazil, we have to have different strategies, from reformulating foods to food procurement policies, improving nutritional labeling, and of course, working on behavioral change, especially through our dietary guidelines. Next, please. So I'll speak about a little bit about some of the strategies, especially the food reformulation. I'm sorry if the slides are a little small here, but the idea here is a part of the impact evaluation of our voluntary targets in Brazil. So we set voluntary targets with industry, which set upper limits for sodium in foods. And we have found that over 8 years of implementation, we have we have a high compliance by industry, but also we had a high rate of decrease in terms of the average salt content in food, reaching over 30% in some food categories. Nevertheless, when we look at the regional references, that's the PAHO targets, we still have much to move forward. So that's like when we look at the glass half full and the glass half empty, so we can always move forward with the evaluation. Next, please. And then we started working on something that the project gave birth to many partnerships, and this is a partnership with the University of Liverpool in the UK. We're building a microsimulation study in Brazil that actually we started first evaluating our voluntary targets, but also, and the next slides I will show a little bit of adding more policies and how the impact can be improved through that. So we do see there is a huge impact even through the voluntary targets, like preventing or postponing over 182,000 cardiovascular disease cases and 14,000 deaths. And that leads to a huge economic saving as well, net savings of almost $300 million in terms of formal and informal healthcare. But we always look forward that we know that the mandatory processes are much more impactful. So next, please. We started evaluating both our food survey data, but also the impacts on health. So here's just to show that the impact that we predict in terms of reducing sodium voluntarily or using mandatory approaches would be very much different, and we can have almost a threefold increase in terms of impact if we adopted the lowest targets in the whole world, and we would have a twofold increase in impact if we adopted the first PAHO target. So we're actually redoing the study with both the global benchmarks and the PAHO new targets, but it already shows that we have lots to move forward. Next, please. And our final study that I'd like to share is on some preliminary results on what I said is how to evaluate the different policies. So we evaluated comparing the current voluntary targets. Even if these voluntary targets were made mandatory, that would increase the impact almost twice. And if we adopted the global mandatory targets, it would be a much huger impact in terms of cases and deaths of cardiovascular disease. And we actually added some other policies to the portfolio, comparing traffic light and warning, front of pack labelings. And so we see that the impact of warnings is much higher than the traffic lights. Communication campaigns has a smaller impact, but it's very important to be part of our policies. And finally, because we have such a high consumption of table salt, we also modeled a 10% potassium, low sodium salt in Brazil, which would also have a huge impact in terms of cases and deaths because of this participation. So, and many of these policies could actually be added in terms of impact. So the impact at the left, we see the burden, the economic burden, which is huge. It's over $1 billion, $2 billion in terms of the mandatory targets, and almost $2 billion in terms of the low sodium salt. So we do have to take into account many of these policies when planning and implementing what we're doing. Next, please. So to finish my presentation, I just speak about the next steps, which is continue adjusting the targets and including new food categories based on what we have in terms of monitoring and evaluation, strengthening the other salt reduction policies that was shown by the last slide, and continue to model these policies. But they're very important to have these scenarios on morbid mortality, on costs, and even cost effectiveness. That's a layer that we haven't added yet, but it's very important, especially when engaging with the industry and thinking about more effective strategies, which perhaps may include fiscal and regulatory processes. And finally, continue this monitoring of the actual impacts. And I'd finally like to keep the door open to any countries that would like to be in contact with us, with the technical advisor group from PAHO. It could mediate this contact. So we would be very happy to help other countries, and think we have trying to show that this data and this kind of evaluation is very important for designing policy and for actually building most cost-effective policies, so we can have the most benefit on the populations, which also translate to a huge economic net economy as well. Thank you very much.
Thank you very much, Eduardo, for your very succinct but very informative presentation. Okay, and all right, so we at PAHO, we now want to share with you some other activities that we're undertaking and some of the tools that we have developed, which are available for you all, including an interactive tool of salt reduction initiatives in the region. So I'm going to ask Lorena and Maria to lead this presentation, please. We will get to some of your questions, but the presenters are answering your questions as we go along, and we hope we will be able to have time to answer some of them live. Over to you, Lorena.
Thank you, Audrey. Buenos días a todos y todas. Un gusto estar acá.
Thank you, Audrey. A good day to all of you. I'm going to be very brief because I know we don't have time. In this presentation, we wanted to review some of the tools that are available to you, and I am going to give a few minutes to Maria so she may share the social marketing program with you. Basically, Rosela, can you please share my presentation because it's stuck? I will continue speaking. I don't want to waste time, but can you please share the screen? Simply said, this work is around the policies of the Shake package, and it has to do, next please, it has to do with the 5 action lines: vigilance, mobilization of the sector related to reformulating processed and ultra-processed products, which Fabio was already discussed by Fabio, the adoption of standards, which are also related to have a clear frontal labeling, the strategies to increase awareness with regard to the damage to health. Maria will talk about our social marketing program and the strategies in the surroundings. Next, please, in order to foster more healthy environment, especially focused on schools. When all Shake strategies are applied, obviously this has very good investments, positive results. The hypertension is reduced, mortality is reduced, the load of disease is reduced, and as a consequence, the economy also improved. So this is a virtuous circle, and this is why we are promoting these strategies. Next, and now we will review one of the tools which we have. It is a regional mapping, which is already available in English and in Spanish, where we have conducted survey to countries that sent information which is validated by them. Next slide. There has been significant progress with regard to all the policies of the Shake package. We do not have a country in the region that has been able to implement all the Shake package policies, so we are trying to strengthen the implementation of these policies. This mapping was also fed into the virtual tool, which we will share. We are going to share the links unless my colleagues have already done so. This is a tool which I will leave for you to get acquainted with later. It contains information about the progress done by each country per policy for each one of the Shake strategies. And the next one will just show you, next one too, each of the tabs, you will see a specific information on each country. And we will give you the link so you may be able to navigate this and be aware of the information that we have. There is a repository for information and policies which have been shared by the countries. Based on this mapping, we want to share that we have diagnosed 7 countries based on scholarship, Resources to Save Lives, and we worked in 7 countries where we wanted to know how did the civil society and other local actors felt, representatives of the ministries of health, in order to find out their perception with regard to the implementation, the level of interest, technical capacity, or capacity that needs to be built, and all this in order to see which are the strengths and the weaknesses and which are the threats that each country faces in order to make progress in this agenda.
Now, this was quite useful to give us a concrete understanding and outlook of what all the different players involved are among the countries involved: Argentina, Bolivia, Costa Rica, Ecuador, Panama, Peru, and Uruguay. And now, of course, it's got the potential of this being replicated in other countries of the region as a complementary tool for monitoring of policies. And it was also very important for us to understand what local policies there are for designing specific strategies in each country. As regards our analysis, and I'll be brief, of course, there was a lot of heterogeneity as well as similarities in the different contexts. This also poses some opportunities to promote policies in each one of the recommendations in the SHAKE package, according to the different strategies adopted at the local level for collaboration and integration. That means it's very important for us to build in all the different agendas from different groups, civil society, for example, that's working on prevention, child obesity. It's also been helpful for us to have a better idea of what different opportunities there are for collaboration, how important it is for our region, for the different actors, different countries, to share their experiences regarding the policy implementation processes. And as Eduardo said, the evidence that underpins all of these different processes. And of course, there's a need we've seen to step up surveillance and to keep an eye on salt content in the different processed and ultra-processed products. It's a challenge and a common concern for all of the countries involved, which really speaks to the priority that these policies actually translate into something concrete that can bring down salt intake in our countries. The next steps, our strategy is to work with each one of these countries. We are working on putting together a 5-year roadmap that includes each one of these strategies of the SHAKE approach, holding meetings with countries regionally for the exchange of information and experiences. And we will also be offering support to countries in this first stage to gather more sodium information, that is how much sodium is in each one of their processed food items, and for the implementation of policies under the SHAKE package of WHO. And I stand by for any questions you may have. Thank you, Lorena. I'm going to share my screen quickly. Here's my presentation. I'll be speaking in Spanish. I won't take too much time, but among the different activities mentioned, we also have the social marketing program for public health, which consists of defining a concept in which a priority population is chosen. Information is gathered with which to carry out research for information purposes. Participants can create a different intervention plan built on the 4 Ps of the social marketing program. I'll talk about that in short. Now, there are 5 different modules in this program based on the identification of the different elements. A communication plan is crafted to implement the development, assessment, and monitoring of these different interventions, which will help carry out social change. I realized I didn't have my presentation in presentation view. Now, the first thing that we really have to understand is what the social market or marketing approach is. This is a focus for the purpose of bringing about a behavioral change by using traditional marketing tools to, again, promote sustainable social change that's positive. Now, this is done through intervening in the social market, which helps us achieve what we're seeking to do, which is to bring about social change in the population, mindful of the risk factors and nutrition. This is focused on people, on consumers, understanding their motivations, barriers, and to come up with a product that actually meets their needs. Within the research that's conducted, we also seek to obtain basic scientific information about, and social marketing helps us to bring about this behavioral change to enhance access to a service or to promote the use of a new product. As a part of the social market, marketing effort, among the main traits that I've already mentioned, there is a strategy first to come up with a plan in which we prioritize the population to come up with a product for it and to develop an integrated marketing approach within which to carry out whatever approach we have identified as being the best one. Now, in the second aspect of this, this is available in the virtual campus of PAHO. This is an interactive study plan with 5 modules. These 5 modules have been prepared for healthcare professionals where they can use this as a development tool to develop their programs to bring about behavior change. All of the participants have access to this program. Staff of PAHO and their partners. You don't have to have prior knowledge, experience in social marketing. This second module will start in March. We hope to select a group from the different countries and the health ministries, people who engage in this tutoring for these 5 courses and to come up with different interventions. Now, anyone who's interested in taking part in this program, you can use this link. This is a self-guided process, self-learning process. Now, in this social marketing program, there are a number of case studies. I probably will not have much time to delve into them right now, but I would just mention one now, which is the one carried out in Peru, SALLIS, based on the tools of social marketing. This group of researchers in Peru came up with quite an effective intervention, again, following the social marketing approach with which they implemented it. Now, we have this other case in which a mapping exercise was undertaken. We talked about, or worked with 5 different women who talked about how they use salt when they cook. That's a case study, and how social marketing was implemented in this case using this mapping approach. You could take a closer look by clicking on these links. I thank you for listening in. Thank you, Lorena.
Thank you, Lorena and Maria, for really reviewing with us some of the activities that PAHO is undertaking. We are already over time, but there are a few outstanding questions, and the panelists have been doing their best to answer these in the Q&A. There is one, however, that I think in a general sense, I'll ask you And I'll ask Fabio to answer that one. And that is one of the recent questions which was asked about how PAHO will be assisting member countries to launch the national policies and initiatives addressing dietary sodium and salt intake reduction. So if you could answer that one for us, please, Fabio.
Sure. Thank you, Audrey. Yeah, so in the general, so the way we're working with our counterparts, the Minister of Health in the countries, first, I think this webinar is part of what we're doing, disseminating the existence of the new targets and engaging governments and other actors to move forward in adopting them. And then we're also conducting and discussing with different countries a roadmap to establish the necessary steps. Different countries have different processes that they need to go through to adopt these targets or update targets they already have. So we're working with the different countries to establish the necessary steps for the countries to adopt these targets and implement them, enforce them in a way that we can shift the food systems into healthier food systems for all populations in the Americas. Thank you.
Thank you, Fabio. And I'm very sorry we won't have time to answer any more questions live, but I think the panelists have done a very good job in the Q&A. If there are any, we will review and see if we missed anything. And if so, we will try to get a response back to you. But for now, I'd like to thank everyone for participating in this webinar. We have been going through some of the tools that we have at PAHO to really assist countries in the process of implementing the salt reduction initiatives, such as the updated PAHO sodium reduction targets that Fabio shared, and the interactive tool and the mapping that Lorena presented, along with the work that we're doing in specific countries, including, for example, the elaboration of the 5-year roadmaps. And finally, also our social marketing program that Maria shared with you and that is available if anyone is interested. And I see that there has already been some interest shared in the chat and in the Q&A. I want to also thank our colleagues from Trinidad and Tobago and Brazil for sharing their latest work and how this work is expected to be translated into actual actions in their countries. So I hope that you found this webinar useful and informative, and we will have the recordings. There have been a lot of questions about the presentations and recordings. We will have them available in the 3 languages soon on our website. And we hope that this World Salt Awareness Week contributes to further action and progress in our region of the Americas. Thanks again, everyone.